In the 24 hours till 8 p.m. last night in New South Wales, there were 594 locally acquired cases of COVID-19. There were also 90,680 COVID-19 tests reported. Across New South Wales, 88.6% of people aged 16 and over have received a first dose of a COVID-19 vaccine, and 67.7% are fully vaccinated. So thank you very much, everybody, for your ongoing terrific efforts in coming forward to get vaccinated. It's really pleasing to see such high coverage of vaccination across the state. In total, in New South Wales, we've now administered 10.45 million doses of vaccine, which is truly an incredible effort. Sadly, today we are reporting the deaths of 10 people, 7 men and 3 women. 1 person was in their 40s, 1 person was in their 60s, 4 people were in their 70s, 2 people were in their 80s, and 2 people were in their 90s. 5 people who passed away were from southwestern Sydney, 3 people from Western Sydney, 1 person from Wollongong, and 1 person from the Edward River region. 3 of the individuals who passed away were not vaccinated, 3 had received 2 doses of vaccine, and 4 people had received 1 dose of a COVID-19 vaccine. 3 people who passed away, a man in his 60s and 2 men in their 80s, acquired their infections at the Allity Beechwood Aged Care Facility in Revesby. And these are the first deaths that are linked to an outbreak at this facility. A man in his 70s died at Westmead Hospital, and his is the first death linked to an outbreak at the North Court Aged Care Facility in North Parramatta. And this is the second death linked to that outbreak. A woman in her 70s from the Edward River region died at the Alfred Hospital in Melbourne. She acquired her infection in the community before being transferred to Melbourne for further specialist care. On behalf of New South Wales Health, I extend my sincere condolences to the loved ones, the families, the friends of these 10 people whose deaths we are sadly reporting today. Their deaths bring the total COVID-19 deaths in New South Wales to 395 since the 16th of June and 451 in total since the beginning of the pandemic. Today I'd like to ask the residents of the following areas to be especially vigilant for symptoms, to come forward for testing and to please get vaccinated. And they are residents in some of our regional areas, including Jindabyne, Fig Tree in the Illawarra, Merewether, Wallsend, Cessnock in the Hunter, and also Blue Haven in the Central Coast. So if you live in any of those areas, I particularly encourage you to come forward for testing and please get vaccinated. I'd like to also encourage residents of Mount Druitt, Guildford, Belmore and Croydon Park, like in other areas of southwestern and western Sydney, to continue your fantastic efforts to get tested promptly if you have symptoms and to get vaccinated. I'd like to give you a bit more information about some of our regional areas. In the Illawarra Shoalhaven area, there were 51 new cases reported till 8 p.m. last night, and the majority of those cases came from the Wollongong local government area, so 42 of the 51 cases. In Hunter, New England, 93 new cases were reported till 8 p.m. last night. 27 of those from the Newcastle LGA and 26 from the Lake Macquarie local government area. There were 30 new cases reported in the Central Coast, and in southern New South Wales there were 12 new COVID-19 cases reported, and the majority of those with links to known cases, which is good news. In Western New South Wales there were 8 new cases of COVID-19 reported. In northern New South Wales, 3 new cases. In Murrumbidgee, 1 new case reported. In Far West, also 1 new case reported. And in the Mid-North Coast region, 2 new cases reported. So I want to end by saying, firstly, a big thank you to everybody for staying the course through some very challenging months ahead. From New South Wales Health, we are really pleased to see our case numbers stabilising and going down. We're really pleased to see the vaccination rates increase to the levels that they have, and we're keen to see those rates go even higher across all areas of the state. I know that the community are really keen to get back to the things that we all love, and especially when the weather outside is so beautiful at the moment. However, I do want to say that it is really important that as we open up, we all act cautiously, that we continue to follow the revised public health advice that will apply as we progressively follow the roadmap. And it's really important for people to continue to come forward for vaccination, to continue to get tested if you have even the mildest of symptoms. And all of this is really important to make sure that the gains that we've made in these difficult months are retained into the future. So really important for us to all continue to follow the public health advice, get tested, get vaccinated. Thank you very much.